Join me as I dive into the world of frozen shoulder treatments and challenge myself to find out which method really works best: physical therapy, meds, or surgery. Frozen shoulder, also known as adhesive capsulitis, is a condition that affects millions of people worldwide. It's characterized by stiffness, pain, and limited mobility in the shoulder joint. If you're one of the unlucky ones dealing with this condition, you know how frustrating it can be to perform even the simplest tasks, like reaching for a cup of coffee or putting on a shirt. The symptoms can be overwhelming, ranging from dull aches to sharp pains, and even numbness or tingling sensations in the arm. It's no wonder that people are often desperate for a solution, any solution, to alleviate their discomfort. But here's the thing: there's no one-size-fits-all approach to treating frozen shoulder. That's why understanding the different treatment options available is crucial in finding the right path to recovery. In this video, we'll explore the three main treatment approaches: physical therapy, medications, and surgery. We'll delve into the benefits and drawbacks of each, and I'll share expert insights and real-life success stories to help you make an informed decision about which route to take. When it comes to treating frozen shoulder, physical therapy, medications, and surgery are the three main contenders. Physical therapy focuses on exercises and stretches to regain mobility and strength. Medications, on the other hand, aim to reduce pain and inflammation. And surgery, well, that's usually a last resort, but can be effective in releasing the tightened joint capsule. Each of these approaches has its own set of advantages and disadvantages, which we'll discuss in more detail throughout this video. Let's start with physical therapy, which is often the first line of defense against frozen shoulder. This approach is ideal for those in the early stages of the condition, as it can help improve range of motion and reduce stiffness. Physical therapy involves a series of exercises and stretches tailored to individual needs, usually performed under the guidance of a licensed therapist. The goal is to break up the scar tissue and adhesions that cause the joint to freeze up. One of the biggest benefits of physical therapy is that it's a non-invasive and non-pharmacological approach, which means fewer risks and side effects. In fact, studies have shown that physical therapy can be just as effective as surgery in improving mobility and reducing pain in the long run. But physical therapy requires commitment and patience. It can take several months to see significant improvements, and it's not uncommon for patients to experience frustration and disappointment along the way. Expert physical therapists agree that a well-structured exercise program can make all the difference in the world. They emphasize the importance of gentle, progressive movements that don't exacerbate the condition. One success story comes from Sarah, who struggled with frozen shoulder for years before finding relief through physical therapy. She credits her therapist for creating a customized exercise plan that slowly but surely improved her range of motion and reduced her pain. While physical therapy can be an excellent option, it's not suitable for everyone. Some people may experience too much pain or stiffness to participate in exercises, or they might have underlying conditions that make physical therapy less effective. That's where medications come in, a common approach to reducing pain and inflammation. The most commonly prescribed medications for frozen shoulder include pain relievers, such as acetaminophen or ibuprofen, and corticosteroids to reduce inflammation. Medications can provide quick relief from pain and discomfort, especially during the acute phase of the condition. However, medications often come with a host of side effects, such as stomach problems, dizziness, and even addiction. Moreover, they only mask the symptoms rather than addressing the underlying cause of the condition. Many patients struggle with the emotional toll of dealing with chronic pain, which can lead to depression, anxiety, and feelings of isolation. One patient confided in me that the constant pain made her feel like a prisoner in her own body. She felt helpless and frustrated, unable to do the things she loved. In severe cases of frozen shoulder, surgery may be the only option. This involves releasing the tightened joint capsule to improve mobility and reduce pain. Surgery is usually considered when other treatments have failed, or if the condition is causing significant impairment. The decision to undergo surgery is never taken lightly, and it requires careful consideration of the pros and cons. Patients need to weigh the potential benefits against the risks of surgical complications, infection, and prolonged recovery time. One expert orthopedic surgeon emphasized the importance of a thorough evaluation before opting for surgery. He stressed that patients need to have realistic expectations about the outcome and be prepared for a lengthy rehabilitation process. In some cases, surgery can be a game changer, offering significant improvements in mobility and pain reduction. But it's essential to remember that surgery is not a quick fix. It requires commitment to post-operative rehabilitation and a willingness to put in the work to regain strength and mobility. So, which treatment approach is best for frozen shoulder? The answer is not so simple. Each individual's needs and circumstances are unique, and what works for one person may not work for another. Physical therapy can be an effective and non-invasive approach for those in the early stages of the condition. Medications can provide quick relief from pain, but may come with unwanted side effects. And surgery, while often a last resort, can offer significant improvements for those with severe cases of frozen shoulder. Ultimately, the key to successful treatment lies in understanding your individual needs and working closely with your healthcare provider to determine the best course of action. If you've struggled with frozen shoulder, I'd love to hear about your experiences with different treatments. Share your stories and insights in the comments below. And if you're new here, consider subscribing for more informative content on health and wellness. Thanks for watching, and I'll see you in the next video.